Everyone who needs an NHS dentist will be able to see one. That's the pledge from Labour, as they promise to tackle the crisis in children's dentistry with 100,000 extra appointments.
But having ruled out any major tax rises, it's yet another plan Labour say they'll fund with a clampdown on tax dodgers. Join us now, Shadow Health Secretary Wes Streeting. Is that the case, Wes Streeting? Good morning to you. That this is going to be paid for out of money reaped from people who are avoiding tax? What's the plan?
Yeah, we've set out a £1.6 billion package to tackle the waiting crisis in the NHS, including the 700,000 emergency dentistry appointments, 100,000 of which will be allocated for children. And that's funded through a combination of clamping down on tax avoidance and also closing the remaining non-dom loopholes. And the way in which we've reached a figure we can be confident in is using figures from the National Audit Office, who say that as long as HMRC are given the investigators they need and updated technology they need, which Rachel Reeves has committed to and funded as part of her plans, we can recoup that money. And that's the difference between Labour's approach to clamping down on tax avoidance and what we're going to hear from the Conservatives today, because what they seem to be saying is...
You'd need to pay for more civil servants to do that, but you think that it would pay back enough money to fund this
more
proposal.
Than pay for it.
Can you see that?
That's what the National Audit Officer said.
Right.
Give HMRC the tools to do the job, and we can get the revenues in, which I think is a fairer choice than what the Conservatives have done in recent years, which is to clobber working people with rises in their personal taxes, which we just know at the moment people can't afford, which is why we've ruled out increases in income tax, national insurance and VAT, because we want to give people that reassurance. We know people are struggling. We know they can't afford tax rises, and that's why Labour's making fairer choices and also being very disciplined about the promises we make in our manifesto, so that you can have confidence they're promises that we can keep and you can afford.
Can I ask about one particular suggestion that you've put forward, which is actually caught light this morning with our viewers, and that is supervised toothbrushing for 3 to 5-year-olds. Now, are you suggesting that teachers should stand up in front of a class of 4 or 5-year-olds, 3-year-olds even, and get them to brush their teeth, up to 30 of them in a class?
So, Keir and I are going to be at a school this morning where I'm standing today, looking at where this is happening in practice and seeing the benefits to children. Look, I have a lot of sympathy with viewers who will be posting on social media or emailing in saying, surely this is parents' responsibility. And they are absolutely right about that. At the same time, we know that in too many cases it's not happening at home, and tooth decay is now the #1 reason for hospital admissions amongst children aged between 6 and 10. So I wish this weren't necessary.
But it's not.
But
the thing is, we're treating it's not
small
just... Yeah, but the trouble is, teachers are emailing in and saying, we can't do this. How many more parental roles, Susanna, are teachers expected to take on? Stop passing the jobs on to teachers. Annie, I'm a foundation teacher. Do you know how much time this will take? We already have to get them to wash their hands for lunch, etc. This is another parental responsibility being passed on to teachers. Carol, I've worked at a school for almost 25 years. To get 30 children to brush their teeth is not something children should do. This is a parenting job.
It's 6 minutes of the school day. Keir and I are going to be seeing this live in action this morning, and the benefits to children, both in terms of their health but also their education. Because if children are sat there in agony with toothache, they're not concentrating on what's going on in class. Their behaviour is more likely to be disruptive. We think this is a practical, effective measure targeted on areas of high levels of deprivation where we know we've got the biggest problem with tooth decay. And this investment, I think, is absolutely worthwhile when you think about not just the cost to children's education, learning, their health and well-being of suffering with tooth decay, but also think about the cost to the NHS of those kids ending up in A&E and having to have that emergency work.
Okay.
So we've got to do the right thing by children. Children have got to be the priority, and I'd rather take action on this than let children suffer.
Can I ask you about the Tory manifesto today? They are going to be offering a further 2p cut in national insurance. Labour has backed the previous cuts in national insurance. We now know that you aren't going to reverse the Conservatives' changes on pension taxation and the pension cap. Will Labour deliver the 2p cut in national insurance the Conservatives are promising today?
That's not a commitment we're going to be able to make in our manifesto because the money isn't there. And if Rishi Sunak was honest, he would tell the country the money isn't there either. What we are about to see is an act of enormous political desperation. Rishi Sunak pretending that he can splash the cash through tax cuts and spending increases without balancing the books. We have seen this movie before. Look at the damage that Liz Truss did. And when you add up all of the Conservatives' unfunded commitments, this is the Liz Truss mini-budget on steroids. And look, we've been here before as the Labour Party, frankly. People have seen with previous manifestos of ours, if it looks too good to be true, it's too good to be true. And that's exactly where the Conservative Party have found themselves in this extraordinary act of desperation. And this is a dividing line at the general election. When people see Labour's manifesto on Thursday, they will be able to have confidence that the promises we make are promises that we can keep and promises the country can afford.
Okay, so
Rishi Sunak cannot make that promise, and if he does, he's lying to you.
Can I ask you just, we had an email from Stuart. I don't understand why the parties are trying to score points offering tax cuts. I'd much rather that the money was used to repair the broken NHS. I think most Labour voters, if there is more money coming in this year, if the growth is stronger, they would prefer you to spend more money on the National Health Service before further tax cuts. Is that your instinct?
So I'd say two things, Ed. Firstly, in terms of the investment we've already set out and will set out in our manifesto, we've made fairer choices about raising that money through things like clamping down on tax avoidance, closing the remaining non-dom loopholes, closing the loopholes enjoyed by private equity fund managers. Those are fairer choices to fund our policies. What's been missing for the last 14 years is economic growth. If the economy had been growing under the Conservatives at the rate it did under the last Labour government, there'd be over £30 billion to invest in our public services without having to hike up taxes on people. So I think when people see Labour's manifesto, they will see that when it comes to raising money, we make fairer choices. When it comes to spending money, we're making wiser choices. And ultimately, we've got to get our economy back to growth. What we're not going to do is
priority would be to spend some more on the National Health Service.
Income tax, national insurance and VAT.
But if there was money available, you'd spend more on the NHS first.
Well, there are some real spending challenges in the NHS. I've acknowledged that, and that's why we've already made a significant commitment to the NHS. But the other argument I've been making around the NHS, we've also got to spend the money that's going in more wisely too. And we spend almost £170 billion on the NHS. We always talk about how we might spend, you know, a few billion more here or there or anywhere else. But there's also a huge amount of money that goes into the NHS, and because of bad decisions and because of a lack of reform in the NHS, we end up in the absurd position where, because someone can't get a GP appointment because there are thousands fewer GPs, instead of spending 40 quid on a GP appointment, the NHS is spending about £400 on someone who's walked into A&E instead. So we've got to get that balance right. The investment, of course, is needed, and we're setting out plans for investment, but we've also got to reform to make sure the NHS is spending money more wisely, because whether there's staff working in the NHS or patients using the NHS, people can see examples of waste and inefficiency in the system on a daily basis. And I'm hearing that very strongly from staff as well as patients.
Well, Steve, we have to let you go. Thank you very much indeed for joining us.
Thank you.
Health Secretary not saying that his instinct...
Shadow Health Secretary.
Shadow Health Secretary not saying his instinct is to spend more.
That's right. Wanting to be Health Secretary.
Yeah, wanting to be Health Secretary.
Also, that non-dom tax loophole is going to have to pay for quite a lot of things. And that's relying on the non-doms not just leaving.
The loophole that the government's already closed.
Already closed.